Okay guys, let's talk about anti-epileptic seizure drugs. So what is an epilepsy? An epilepsy is a condition of recurrent seizure, and seizures are sudden manifestation of disturbance of behavior, emotion, motor function and sensation that result from abnormal electrical discharge from cerebral neurons. So know that there are 3 million people in the United States that are living with epilepsy. So it's a serious condition. So we have some class of medication we used to treat this condition. We have 5 classes. The first class here are those that modify ionic channels. In particular, they block voltage-gated sodium channels. Example of drugs in this class are phenytoin, fosphenytoin, lacosamide, lamotrigine, carbamazepine, etosizumab, oscarbazepine, rufinamide. The second class of medication has this mechanism of action that is multiple. They have this multiple mechanism of action. Example of drugs in this class are topiramate, felbamate, zonisamide, valproic acid. So guys, the third class of drugs has this mechanism of action that inhibit the excitatory glutaminergic transmission. Example are the pregabalin. Guys, the fourth class of drug has this mechanism of action that is GABAergic. They have this GABAergic activity. Example of drugs in this class are the benzodiazepines, phenobarbital, vigabatrin, tiagabine. Last but not the least, the fifth class of drug has this unknown mechanism of action. We don't know. And gabapentin is one of them. Gabapentin is also used to treat neuropathic pain, so don't forget about that. So, and we also have the second drug here, which is the levetiracetam. Bye for now.